Good morning. Welcome to today's Lunch and Learn. I'm Alexis, the Racial Justice Director of the YWCA of Northwest Ohio, and it's a pleasure to have you join us today. Our agency is very concerned on how race equity and health equity come together. Here at the YWCA, we are dedicated to eliminating racism, empowering women, and promoting peace, justice, freedom, and dignity for all. I also sit on the Health Equity Committee of the Healthy Lucas County. It's a perfect combination to collaborate with Healthy Lucas County to educate the community on health equity issues. So let me just tell you a little bit about them. Under the leadership of Director Jan Ruma, they were formed in 1998. It is a coalition of community organizations working to improve the health of all Lucas County residents. Healthy Lucas County performs a triennial health assessment with data that is collected on behalf of children, youth, and adults. And it develops a 3-year community health development health improvement plan with strategies and action steps. The coalition is especially focused on addressing the needs of residents living in low-income areas and lessening health disparities to help everyone live their fullest potential. Healthy Lucas County is governed by an executive committee of community leaders. And for more information, please visit their website at healthylucascounty.org. Every month, we are joined by wonderful guests who have the expertise to share with you through this platform. So it is a pleasure to be here today to talk with one of our community colleagues from the Area Office on Aging in Northwest Ohio, Tina Gaston. I think Tina is going to be a joy to listen to today. Her topic is the impact of racial inequalities among older adults. So now let me tell you a little about Tina. She has a very, very impressive bio. Tina Gaston currently works as the Director of Nutrition and Wellness Education and Outreach for the Area Office of Aging of Northwest Ohio, Incorporated. In this role, Tina has successfully implemented the Supplemental Nutrition Assistance Program, also known as SNAP, enrollment grant, helping older Northwest Ohioans with limited incomes apply and submit applications for food stamps to prevent and mitigate food insecurity, as well as improve their nutritional status. In addition, she is responsible for developing a robust nutrition educational program and developing new funding streams for evidence-based wellness programs. Prior to joining the Area Office on Aging, Tina worked in public education in various roles as an educator and administrator. Currently, Tina is pursuing her Doctor of Education at the University of Findlay, expecting to graduate in 2022. She is currently working on her dissertation on the role of spirituality in the lives of African American women who have experienced trauma. Tina is a joint council member of the African American Leadership Council of the United Way of Greater Toledo and the chair of the Leadership Development Committee. We are excited to hear your presentation today, Tina. Take it away.
Thank you, Alexi, and thank you, Lisa, and the other staff that invited me to be a part of this wonderful opportunity and being able to share this topic with our community. The impact of racial inequalities among older adults. Dignified aging should be considered a basic human right, yet there are still many Americans who feel they are denied this right. All older adults should be able to age with dignity, and we want to see our aging loved ones live out the remainder of their lives with the dignity and respect that they deserve. Older adults should have access to adequate food, water, shelter, clothing, and healthcare through the provision of income family, community support, governments, and other means. There are many other important things that support older adults in aging with dignity. There are numerous factors that challenge older adults in attaining the right to age with dignity. Research shows that most people prefer to age in place, remaining at home, near family, and in their community as they get older. From data taken from the 2010 Health and Retirement Study, academic literature and researchers examine how neighborhood poverty, disorder, social cohesion, and air pollution affect health outcomes for older adults of different incomes, races, and ethnicities. There are currently more than 4 million African Americans over the age of 65, with a projected growth of about 12 million by 2060. Like the general population of older adults, African American older adults are living longer. Unlike their counterparts, which are the whites, however, African American older adults experience significant health disparities, including lower life expectancies and increased risk of chronic health conditions such as hypertension, diabetes, dementia, stroke, and cancer. Currently across the country, regardless of region, race, inequalities exist across every sector for success, including health, criminal justice, education, jobs, housing, and beyond. These inequalities or inequities are contrary to what we desire as the human race. And just to kind of give a little definition to equality, it is sameness. Everyone gets the same thing. Equality focuses on everyone getting the same opportunity, but often ignores the realities of historical exclusion and power differentials among whites and other racialized groups. As it pertains to racial inequalities among older adults, I wanted to focus on 3 of the biggest inequalities facing Black elders today. And one of the races that is closely associated that face these challenges as well is Hispanics. So we're going to talk about poverty, health disparities, and affordable housing. As it pertains to poverty, while African American older adults make up 9% of the older or elderly population, they represent 21% of the elder population living below the federal poverty guideline. According to the Administration of Aging, the poverty rate for Black elders living in the US is more than twice the rate of all elders. As a result of the poverty that is experienced for African Americans, and it is a great likelihood that they deal with more stress, immunity issues. They deal with a lack of food and healthy food options. They face discrimination and a lack of access to regular health care. Poverty among adults in low-income areas is 66% of older Blacks and 60% of older Hispanics residing in high poverty neighborhoods, compared with just 20% of older whites. As it pertains to health disparities, let's go back. Research shows that most Black elders have at least one chronic condition, and many have multiple conditions. And the most frequently occurring conditions among Black elders include hypertension, diagnosed arthritis, diabetes, and cancer. More health disparities. As the novel coronavirus has spread across the United States, Black Americans have been disproportionately affected by infections and deaths. Among Black Americans ages 65 and older, death rates from COVID-19, the disease caused by the coronavirus, appeared to be 3 times that of white peers. And I've found this to be true because here at the agency, we helped with receiving calls to schedule our community of older adults and pretty much everyone for the vaccination. And one of the things that I found very common among those that were calling, particularly Black African Americans, is that they were very afraid of even taking the vaccination, but they had dealt with the coronavirus. So just having a trust issue and dealing with chronic issues and things of that nature, they were very uncomfortable, mistrusting, but they knew how important the vaccination was. So a lot of them have been impacted in so many different ways. And one of the ways that I found have been very impactful for everyone was the stress of just knowing that they have chronic issues and dealing with the coronavirus. The pandemic has highlighted health disparities between Black and white Americans compared with their counterparts or white counterparts. Black men and women have lower life expectancies and a higher prevalence of health conditions such as hypertension, diabetes, dementia, stroke, and cancer. Another one that's an inequality that we see with older adults is affordable housing and housing conditions. At every level of income, Hispanic and Black older adults are more likely than twice as likely to live in high poverty neighborhoods than white older adults, with some income levels showing much larger disparities. Affordable housing is a problem for many elders in areas across the country. Yet for Black elders, this problem is magnified since the majority of Black elders live in states with high cost of living, and some are living in crowded housing conditions. The problem is exacerbated for Black elders due to poverty levels, prejudice, and discrimination. Another issue that I want to continue to further talk about as it relates to the housing is residents of economically disadvantaged homes and neighborhoods, regardless of their income level, are more likely to suffer from chronic diseases. And some of this information could be a little repetitive as it relates to like the effects or what have you, but research has been very consistent on showing how chronic diseases is a huge issue within the African American community and Hispanic as it relates to their inequalities. So I mentioned, they suffer from chronic diseases, mobility issues, cognitive impairment, and accelerated biological aging than those living in more economically prosperous neighborhoods. And research is also showing that when we're talking about cognitive impairment and accelerated biological aging, this is talking about severe mental issues as it relates to not having the proper resources and services in place that has really taken a toll on older adults mentally. Neighborhood disorder, from vacant buildings to safety concerns, can cause physiological distress and reduce rates of physical activity among older adults. Older adults with higher incomes generally perceive less disorder in their neighborhoods, but more Hispanic and Black older adults see signs of disorder in their neighborhoods than white adults, regardless of their income. So as we can see here, these inequalities is really pressing and stressful on older adults. Again, as it relates to affordable housing and health condition or housing condition, research shows that exposure to air pollution can lead to severe respiratory damage, cause inflammation and blood clots, and damage the structure and function of an aging brain. At every level of income, a larger portion of older adults live in high pollution neighborhoods that can then do white adults. A growing body of research shows that because of discriminatory housing practices such as redlining, older Black adults are more likely to live in racially segregated neighborhoods characterized by high poverty levels, lacking in healthcare services and amenities, such as grocery stores and parks, and poorly maintained housing and infrastructure. And I would talk about it a little bit more as it relates to amenities, as it pertains to grocery stores and parks, just being in these affordable, I believe affordable housing is very important for older adults, because it really helps with, them being in a neighborhood. It would be really good for them to be in a neighborhood where there are stores that have quality food and not aged food or stale food, and parks and just the ambiance in the neighborhood. It really uplifts their spirit and it uplifts their mental capacity. Racial inequalities as it relates to healthcare or health outcomes. Nursing homes had a significant number of Black residents that have been twice as likely to be hit by the coronavirus as those were the population of overwhelmingly whites. The coronavirus pandemic has devastated the nation's nursing homes, sickening staff members, ravaging residents, and contributing to the at least 20% of the nation's COVID-19 death toll. So many older adults has been really impacted in nursing homes as it relates to health, the health outcome. A lot, I've spoken with people that has called in the agency that had family members that were in nursing home. They were not even able to see their loved ones. So now that things are beginning to open up a little bit more, they're able to see their loved ones. But I spoke to one lady in particular, and she shared with me how she would go and visit her mom in the nursing home, and she was not able to go visit her mom anymore, but they gave her the opportunity to kind of look at her from out the window. So she was able to go and visit by smiling, looking at her out the window. But one of the things that she said that was very heartbreaking is that her mom had a friend that she was in a very good relationship with. And because she did not have anyone and she was basically alone, she ended up passing away during COVID-19 when it first started. So just the social isolation, not being able to see your loved ones, not being able to have a human touch is really, really devastating for a lot of older adults, especially during this time that we're living in the nursing homes. Further inequalities in older adults. The virus and the resulting economic shutdown are exacerbating longstanding inequalities in American society, or inequities, widening economic gaps and health disparities. And the impacts are both physical and psychological, are likely to be long lasting. Older adults report shortages of critical medications and struggles in accessing care. A lot of them have struggles in accessing care, medication, medical supplies. Meanwhile, people live on limited incomes, can't afford to purchase food and supplies. And many in service industries have lost their jobs. Also, older adults most likely to lack resources and to need healthcare and community services. And I will be able to talk a little bit more about some of the things that we're doing here at the agency to help older adults in our community. But this is not only a local, statewide issue, this is a national issue where older adults are experiencing a lot of inequalities. One thing that is really on the rise, and it's a huge trend right now, and it's a public issue, and it's not just public, but it's national, is senior hunger. Nearly 1 in every 6 seniors in America faces the threat of hunger and not being properly nourished. And as I mentioned earlier, I'm saying properly nourished with having the right foods, being able to eat the right food, having quality food having access to vegetables, having access to the right food so that they can live longer. And not only that not contract, some of the chronic issues that a lot of them face. And this applies to those who aren't sure where their next meal is coming from, and those who don't have access to the healthiest possible food options. This is a severe issue as it relates to food insecurity. Food insecurity simply means that a person is not receiving or don't have access to the necessary foods and nutrients to help sustain their life. Food supply is limited. Some older adults live in areas where access to fresh produce, as I talked about, and food is limited and known as food deserts. Those food deserts are neighborhoods where there's not access to stores that's within reach, where older adults can get to those stores and get fresh quality food. So that's a food desert where there's no access, there's a limitation, or if there is a store in the neighborhood in a food desert, majority of the time those stores have unhealthy food, aged food that is stale and not quality for those that are older adults. As seniors become more food insecure, they also become more likely to develop diseases and illnesses that can cut their life short. There are so many, I've spoken with seniors, and I really appreciate the work that we're doing here at the agency, as well as all of our community partners and those that are in the community that are helping older adults. But there are so many seniors that have that I've spoken with in the community that has spoken about, not having the proper food to eat, or going to the store that is close to them in their neighborhood where the food is not quality. And even research shows that a lot of times when the food is not quality, older adults begin to resort to unhealthy food. So they might buy chips, or they might buy candy or other kinds of food just to get some food in their system. So it's so important that, we continue to do the work that we're doing in the community as an agency with Area Office on Aging, but also everyone else that is doing a great work in this community to assist those that are older adults. And there are many negative effects as it pertains to food insecurity that has on the heart. So when it comes down to the physical heart, it becomes a pressing issue for them that are older adults, and it becomes a stress on their physical heart, which leads to heart failure, and it ultimately leads to death. The overall quality of food and how inconsistently it's eaten plays a role in developing type 2 diabetes in seniors. So when seniors that are not receiving the proper food and nutrients, they have a likelihood of type 2 diabetes, depression, heart failure, and other chronic diseases that leads to an early death. And as you guys can see at the beginning of this presentation, I spoke about how seniors are living longer, and the world will be highly populated with more seniors living longer lives by 2050. So these inequalities have to be at the forefront of our policy makers, those that are making decisions. We have to keep our seniors and our older adults at the forefront of every plan that we make, so that they are getting the proper resources and services that they need so that they can age with dignity. Adults ages 60 and older are at a higher risk of severe illness and death from COVID-19. So this is where we talk about the older adults in COVID-19. There is tons of information out there. There's a ton of research out there, and it focuses on the novel coronavirus. And what we have seen is that older Blacks are especially at risk. The pandemic's heavy toll on older Black Americans is linked to structural racism, larger systems of inequality embedded in major U.S. social institutions. These unequal structures limit Black Americans' access to quality health care and increase their overall risk for chronic disease, premature aging, and COVID-19 infection. And I'm sure some of you guys can attest to this because we have seen it not only, in our community and with the constituents that we serve, but we've seen it closely related to us in terms of our family members. And there are so many people that I know that are close to me that are older adults that has passed away that was like a surprise that has passed away because of COVID-19 and not having the proper health care or not having access to the medical supplies and things that they need because COVID-19 came by surprise for all of us. And so a lot of older adults already had issues. These inequalities that I'm talking about already existed way before COVID-19. What COVID-19 has done it has made this issue broader. It has brought this issue more to light, and it has highlighted that there's a lot of inequalities that older adults face. And we as a community really need to take action on making sure that our older adults and loved ones are cared for and get the proper resources that they need. I want to talk about some of the things that we are doing in the community along with our partners, because we have partnerships with so many different agencies and nonprofit entities within the community. Some of the things that we had to do quickly when COVID came into existence. We provide home delivered meals, as you can see the numbers here. Grab and go meals have been provided to our older adults and those with disabilities. We have provided restaurant meals along with our community partners, as I said, face mask distribution, wellness kits, callers assisted with vaccine scheduling and information, as I talked about earlier. And when it comes to the vaccination, like I said, I mentioned about the inequalities and then I talked about some of the mistrust that there has been among a lot of older adults. There's a lot of older adults that just they're hesitant to take the vaccination. But then I also was a part of receiving calls, and a part of that I spoke to different other nationalities where right when that opportunity became available to get the vaccination and be scheduled, we had several different calls from, tons of calls for people wanting the vaccination, but there's still a lot of older adults that are not vaccinated because of the mistrust. We've also vaccinated, we've had vaccinated at our agency, sponsored clinics. Cases of incontinence supplies were distributed. Friendly visit calls happened. We've done a lot of friendly visit calls. One of the things that I would say that a lot of older adults were impacted during coronavirus, and then not only coronavirus, but like I said, pre-coronavirus, is social isolation. That is a huge issue with older adults, with just not having family members. They may live out of town, or they were married at one point, the spouse passed away. A great amount of them are divorced. You have quite a bit of older adults that are single, living alone. So social isolation is a huge issue. And we've provided tons of friendly visit calls just to check in, let them know, just to let them know that we are here in the community. We can provide, we talked about our resources, things that we offer at the agency, just to let them know that we are here. Because even with my program that I work with here at the agency, I'll talk about it a little bit more, but I noticed that a lot of times when I'm calling constituents, sometimes I might be the only voice that they hear for the day. So not only am I providing a service for them, but it's also, I'm not a licensed counselor, but a lot of times they want to talk. They want to just talk about what they're going through in life and shoot the breeze. And they may talk about what they experienced a long time ago, but just being a listening ear is very, very pivotal, because there is a great amount of older adults that has committed suicide as a result of social isolation. We did the big push recently, but we have developed a vaccine outreach campaign that include posters, flyers, billboards, and commercials, just getting the word out about how important the vaccination is and how it saves lives. And this lady actually that I'm showing is Dr. Anita Lewis Sewell. And she had a 49-year-old daughter who was vaccination hesitant, and she died from COVID-19. And so her story is very powerful. You guys can have access to this presentation to read about her story, but we want to make sure that we're providing opportunities for older adults in every capacity so that they can live longer, healthy lives. And vaccination is a part of that. Also, we have, before the pandemic, we had to pivot quick. All organizations, everybody from every sector had to pivot quick. But one of the initiatives that we have here is the tablet initiative, where older adults can actually receive a tablet so that they can connect with their family members, connect with their doctor's offices. It's a very user-friendly opportunity for them, where they are provided with technical support and also some tutorials just to kind of get them abreast of working on a computer. We are dealing with some that it's like a digital divide, where some absolutely did not know how to use the computer. So it really, really kind of brought that stress on them. So we had an opportunity to provide tablets for older adults in the community, and we have seen great responses from this, and they're very happy to have those tablets. We've also provided air purifiers to many households in our community, so that, with coronavirus going on, and some of the people and the older adults, they have, home health aides or grandchildren or family members in the home. And so these air providers or these air purifiers was an opportunity for them to receive to keep their house air clean, as they have people coming in and out to reduce the germs that can cause coronavirus. And then we have the Neighbors Calling Neighbors opportunity, where volunteers age 55 plus have played a critical role in combating loneliness, as I talked about. Like I said, the distress and the loneliness is very serious among older adults. And so just being able to pick up the phone and have neighbors calling one another, and them just having an opportunity, because a lot of the senior centers and where they congregated and had meals together were shut down. So being able to connect with them via the Neighbors Calling Neighbors program has been a great opportunity in trying to at least reduce the social isolation and the loneliness that seniors face. Again, we provided the home delivered meals. That was a great opportunity, because as you guys know, we could not, a lot of people, we had to shut down the community, we had to shut down the world. So older adults receiving home delivered meals is a great thing. And a lot of people, like I said, a lot of older adults, have food insecure issues, and they do not get the proper food that they need. So these meals that they are receiving are healthy meals. They are good meals. And so we've provided a lot of home delivered meals to those that are older adults and those that are disabled as well. And we provided also grab and go meals to various, and these meals come from various restaurants. So they're not just regular meals that they get, but these are good meals that come from restaurants where they are edible and they enjoy the meals. And I wanted to kind of talk about, when we talked about food insecurity, I work with the SNAP program, Supplemental Nutrition Assistance Program, formerly known as the Food Stamp Program. And so with this program, we have to help older adults 60 plus and those that are disabled, 1,000 constituents apply for food stamps or recertify for food stamps. The SNAP program is the first line of defense as it relates to combating food insecurity. This is a government program. So as I talked about the inequalities as it relates to food hunger and senior hunger, the SNAP program is a program that is very, very helpful in helping seniors combat food insecurity. So I am more than happy to assist those that want to qualify, that are eligible for the SNAP program. And one of the things I want to mention about this program is that as of October 1st, Biden administration has approved an increase of 25%, and that's to all SNAP recipients. So there are some people that may say, you know, I only get $16 per month, but most of the time I let them know that, you know, let your $16 accumulate, and then there's also a 25% increase. So once they have that, they have a nice amount to go purchase healthy groceries. We have our passport and our caregiver support programs here at the agency. One thing that I can say about the caregiver support program is that that program helps support those that are caring for their loved ones, because that can be a very stressful situation when you're caring for your loved ones. And so we have a caregiver support program that provide resources and services to help those that are caring for their loved ones. And then we also have the passport program, which is a very good program to help with people for home care services to meet their needs. We have the adult daycare, which is an essential service for family caregivers who depend on this service. Maybe they want to, if you're caring for a loved one or something of that nature, and you need a day or a few hours to go get your hair done or to do some grocery shopping, the adult daycare can be an assistance to you. And then we have the Kinship Navigator program, which is very huge because as I spoke about the inequalities, there's a lot of inequalities that grandparents face that are 60 and above that deal with inequalities as it relates to caring for their grandchildren. And a lot of these grandparents are caring for their grandchildren because of the death of a loved one, substance abuse, neglect, abandonment, anything that would take them out of their hands of their parents. Grandparents has literally had to step up and help raise the grandchildren. And so they're dealing with a lot of different food insecure issues, inequalities, that most of the inequalities that I named, the grandparents that are raising grandchildren have dealt with them as it relates to even affordable housing. Because a lot of times with grandparents raising grandchildren, there's so many people in the household. So where a grandparent only prepared for themselves and may live in an apartment, a lot of times if they have to take those kids and they only have a 1 or 2 bedroom apartment and they got 3 or 4 kids coming, that becomes a housing issue. And so that's an inequality for them, because a lot of times, they don't get the proper financial means that they are supposed to get caring for the grandchildren. So it's a lot of different inequalities that grandparents or kinship families have to deal with as it relates to inequalities as well. At this time, I'm going to hand this back to Alexi. Thank you guys for your time. Alexi?
Thank you, Tina. Thank you. That was a wonderful presentation. If anyone has any questions, could you please put them in the chat? So just go over some things that you said, and it's interesting because I had a lot of questions, but as you went through, you answered them for me, because I had some questions on, if someone is living in the high poverty area, and they do receive food assistance, how could they gain access to high quality foods? And you said that you have programs that assist African American and old adults with receiving food. and the meal delivery and all of that. And I also wondered, I said, well, grocery stores also deliver, but then there was the challenge of technology. And then you
Correct.
covered that as well and said that you also provide seniors with tablets. A question, do you also assist them with maybe being able to order their groceries so that they can be delivered to their door through the tablet?
Sometimes with the those that are connected with our agency that have like case managers, a lot of times the case managers do assist with them being able to, order their groceries online and helping them with that process.
Oh, that's awesome. Yeah, another thing that you pointed out, you said 66% of older adults live in high poverty areas. And I just, it made me think that many older adults are direct victims of the redlining policies that,
Yes.
and they were, directly excluded from the New Deal and the GI Bill, which, allowed white Americans to, have access to low interest and low cost loans and housing in suburban areas. You can see that the results of this are still affecting older adults today, older African American adults to this very day. They've
Tremendous.
largely, been not able to catch up.
Right.
And then when you add the environmental racism, to the factor, which contributes to the health issues and the disparities, it also, like you mentioned, leads to the COVID, the disparity in the COVID outcomes.
Correct.
And I was just really, I never even thought about the fact that a lot of grandparents are raising their grandkids and, they are forced to live in low poverty areas because of not having the income to be able to afford to move elsewhere when they need a larger place. And so the cycle just continues with the young people. I
And
have
one of the
a
things,
question. Oh, I'm
if I
sorry, go
can
ahead.
sure, Lexi, I want to add to that with the older adults or the grandparents caring for their grandchildren, because I worked in that area for a few years. And one of the things that I heard them say that I found to be very heartfelt is that, they had saved up so much money for themselves. So they had their own retirement, they had their own income without a clue of knowing that they're going to raise their grandchildren. So they were not in poverty, but once they got the grandkids, they went right into the poverty line. And sometimes when they try to apply for certain programs like cash assistance and things of that nature, they may not receive that cash assistance. And so that struggle and that poverty begins to, perpetuate in their lives. So it's just a cycle that needs attention. It's a system that needs attention for them as well. And there are resources and things of that nature available for them, but I believe that more could be done.
Definitely, definitely. And that is such a sad state of affairs that happens to people and then they find themselves in poverty. That leads me into another question. I don't know if you know off the top of your head, but you assist seniors with the food assistance program. What does it take to qualify? Do you know the income thresholds for
Yes.
that
So
or?
yes, there is an income threshold that comes from our local jobs and family services. So if you are, most of the people that I do enroll, majority are single older adults. And so they would have to be eligible or meet the income standard of $1,383 per month. And that is before any like insurance deductibles. And for
Wow.
those that are married, it's $1,868 per month. And like I said, again, it's before any type of Medicare or Medicaid or private insurance is taken out of their checks. So in order for them to be eligible, they would have to meet the income standard. Once they meet that standard, then I go ahead and help them apply for their food stamps. And our team here, so myself and our team help them apply for food stamps.
Yeah, that seems a little bit low considering sometimes that medical in medicine and do you find that seniors have a trouble being able to qualify for the food assistance program, being that they may have income, but then when considered their monthly bills and their medicine costs, are having to make a choice between food and medicine?
That is correct. They definitely have that choice between food and medicine. And I have some, and it's very disappointing, that can call in and they say, well, I'm just maybe $15 short of meeting that income standard. And we have the Senior Farmers Market Coupon Program where older adults can receive fresh produce and vegetables and things, fresh vegetables. They have to be 60 plus, and they do have to meet an income requirement as well. And a lot of times it is the low income older adults. So we had quite a few phone calls that came in from those that are receiving the Senior Farmers Market coupons, which is an excellent program here. But a lot of the ones that expressed interest in SNAP food stamps, which is like a supplemental program from the Senior Farmers Market, they just did not meet that criteria by so many dollars. And so it's heartbreaking because I talk to people on a daily basis. This is like my daily work. And they're saying, but I need the help. You know, they say, I need the help. I don't have the means. So they do have to make that choice of whether I want to buy and purchase my medication or do I want to purchase groceries.
Wow,
and so a lot of them as a result do visit the food banks, because that's an additional way to get groceries in the house and still be able to care for themselves as it relates to their medical issues.
Definitely. They suffer from the benefits cliff.
Yes.
So for the meals, like when the meal delivery program, do they have to qualify for that as well, or is it available for anybody?
It's a part of a qualification program as well. What people can do is call, if they're interested in that particular program, the home delivered meals, they can call our office, and I can give that number. It's 419-382-0624, and they will call our ADRN department. They will reach them, and they actually do an assessment to see where they are financially, to see if they're qualified, and then they will give them they'll set them up to get home delivered meals. But a lot of the people that we do provide services for are those that are low income. But to get further clarity and information for that home delivered meal program, I would suggest that they call into our office, to our ADRN department.
Could you provide that number again? I'm going to put it in the chat.
Again, yes, 419-382-0624. Yes.
Okay.
And they can just call in and say they're interested in home delivered meals. What does that process look like? And then they'll get further assistance.
Wonderful. Thank you.
Mm-hmm.
So how would one, if one wanted to assist in this effort, how would one go about volunteering for meal delivery?
Sure.
If you wanted to help.
Sure. They would have to be 55 years old or older, and they will call our RSVP department here. And this is the same number, 419-382-0624. That's a great opportunity to provide service in helping with delivering meals to people. It's just a wonderful opportunity to serve older adults. They are very receptive, and they're very happy to receive services. So that's a great idea for anyone that would be interested.
And then being 55 and older, it also would help the person who is volunteering also to be out in the community as well. It's a reciprocal
Win-win.
Relationship.
Absolutely.
Nice. Very
Yes.
nice.
And like I said, we have people that make the phone calls as well, just to call people to see how they're doing. So that's a great opportunity for anyone 55 and older that would like to, spend some time in the community and touch those that are in need of help.
That's wonderful. That's wonderful. I do have some comments in the chat. Um, you mentioned healthcare calls. How would we set that up for older members in our community? You mentioned that number. Is that the same phone number that they would call to be able to do that?
Yes, the RSVP. They will ask for our RSVP department, and once they ask for them, they will be directed to our RSVP department, and then they'll tell them exactly what they need to do to be a part of this effort. Now, I would say that our office is still closed due to COVID-19, but we have also had a few people that has come in to do some work here. So just have them give us a call for volunteer opportunities.
Okay, that's very good to know. One issue, well, there's a comment in the chat, and it says one issue that we're seeing at the Fair Housing Center is that African American men are often denied housing due to criminal history.
Mhm.
It's especially egregious when it's an older man who may have committed a crime decades ago
Mhm.
and they're still paying for it. If you encounter this type of discrimination, they said, please contact the Fair Housing Center at 419-241-6161 or 6163. Have you encountered that kind of an issue as well with housing and older adults having
I
that
have
kind of an issue?
I have not seen that, but fair housing would be a good place to call. And then we would say probably legal aid as well. But I have not encountered that kind of situation. But definitely, even when it came down, I can speak about um, the resource guide that you guys did, the research with the Black agenda. And it talked about that, the criminal background and things of that nature, and how a lot of African American men are held captive after years of doing the crime. And so that is something that I do believe is something that needs to be addressed, but I also believe that it takes work, and calling the proper channels to get that assistance is probably the best step to take. So calling fair housing, calling an attorney at legal aid to see how they can help assist with that process.
Thank you for that. Someone said that this has been so helpful, and she works for CASA and wasn't aware of the resources that are available. And so she said she's already shared your information with grandparents that she works with. So that is
Definitely
awesome.
appreciate that. Definitely appreciate that.
That is wonderful. So one more thing I wanted to also bring up, that you talked about the vaccination hesitation. And I totally understood, the hesitation, but given the medical distrust that older Americans have with the medical field, I found it, heartbreaking to have to choose between knowing that you have a chronic health, problem and worrying about dying and
Yes.
actually, being of course, one of the first to,
Mhm.
get the vaccine and not knowing what to expect. Have you encountered a lot of people that have talked about that to you or have expressed that to you and your colleagues?
About the hesitance, being hesitant.
Yes.
I've spoken to some folks on the phone that were hesitant about the vaccination. And again, like I said earlier, that we received thousands of calls in partnership with the Lucas County Health Department. So we were taking in calls, and I did have people that called and had concerns about, being hesitant, but the greatest concern was their chronic illness and then dying. So that was a very emotional, heartfelt situation. And what we're doing is we've been promoting like the vaccination push, and we provide incentives. So although there has been hesitancy, we're beginning to see people lighten up a little bit more and become a little bit more trusting in receiving the vaccination. So it's taken time, but we're making steps towards it. More people being vaccinated.
I was at the vaccination push. It was an awesome event.
Thank you.
Awesome event. And I know you had like 91 people to
Yeah.
get vaccinated just in that day.
Yes.
Yes.
Yes, we had quite a few people coming in being vaccinated. When they see their family members being vaccinated and they're beginning to see, how people are not, there's so much talk about it. But when they begin to see their family members, and I believe it makes them a little bit more encouraged to get vaccinated, and it kind of lessen that hesitancy, and they see other people getting it or what have you. And then some people, they really want the incentives. So
The
they
incentives
go
are
for the
great.
incentives, yes. So that's a great thing because, we want to see our older adults live long lives. We want to see them not chronically ill and not receive, we want them to have the support and resources that they need. And the vaccine is a part of that process because COVID is here. We don't know when it's going to disappear. So we want them to have access to all the resources to help them live long lives and be healthy.
Definitely. That's wonderful. Wonderful. And another question about that. For homebound seniors, is there a program that can get the vaccine to them if they can't come out?
Yes. So what we have been, when we were helping with that process, what the health department was doing is they had like the mobile vans that would go out and actually provide those shots for those that are being vaccinated. So that's, the process where they can actually, call the health department and have them, get vaccinated and have some a mobile nurse or doctor go out, or more so the nurses go out and actually provide those shots for them.
That's great. Good to
Yeah,
know that.
but we actually have, people here that are working with the vaccination program, Regina Russell and Irethia Holly. They are working with the vaccination program here at the Area Office on Aging. And so they can provide more insight, and they may be able to give you more insight on, people that are homebound and that can receive the vaccination. So again, that same number is 419-382-0624. And they can ask for Regina Russell or Irethia Holly. And one of those two can assist with the vaccination questions.
Awesome. Thank you for that. Question. Can you talk about how racism impacts mental and physical health of older African American adults?
Right. Yeah. So that's a huge issue. That is a very big issue and I talked about it a little bit and touched on it, but we when it comes to the stress, the distress, and just the depression that comes as a result, it literally not only affect them mentally, but it affect them physically. And so that's why making sure that they have the proper resources. And there is a lot of older adults that receive counseling and get assistance from a therapy to help them through that process. As I mentioned, the Kinship Navigator program, we had to implement the trauma informed care and talking to them about the traumas that they're going through as it relates to raising their grandchildren. It's totally traumatizing. And so trauma is a huge issue. And we do have a relationship and partnership with NAMI in our community and other counseling services to help older adults if they need counseling services, because it impacts them tremendously. It causes a lot of toil or just pain and mental distress that ultimately affects them physically.
That's very tragic. And I can only imagine the sudden, especially if it happens so suddenly and unexpectedly. We
Right.
have a couple of other questions in the chat. Um, Someone wanted to know, Are there any other volunteer opportunities for anyone younger than 55?
I would have them call our RSVP department and ask. As of right now, I would have them call them at 419-382-0624. They can possibly give some leads on that.
Okay. Okay. And what help is provided for the mental health issues? You kind of spoke on that. For elders, you said you have a partnership with NAMI.
We have a
And they can
relationship,
also do.
yes. NAMI, quite a few different counseling services within our community. As it relates to older adults, it would be good for them to call our ADRN department so that they can give them further information on other counseling services and therapists within our community for older adults. 419-382-0624.
And that number is in the chat for anyone who wants to write that down for all of the programs that Tina's talked about, and for volunteer opportunities, for questions about vaccines, for questions about the food program. You can call that number.
Also the ZEP. And Alexia, I want to mention also ZEP. They help out with counseling as well as Harbor.
Okay.
So yes, behavioral health care and ZEP.
Wonderful. So yeah, you can also contact those agencies if you know of anyone who needs assistance and needs maybe counseling or help with their mental health. Yes. So that is most of the questions that I have today. Thank you so much for a wonderful program and for a wonderful presentation. So informative, and it's so good to know that all of these programs are available for older Americans. I had no idea of some of the programs that you had, so I learned a lot today, and I really thank you so much. And someone said you just answered the question, so I appreciate you being here today.
It is my pleasure.
Thank you. And so if anyone has any more questions or anything that you want to know about, definitely contact the number in the chat. And also, I also wanted to let everyone know that you can click on the link in the chat to complete the evaluation for today's program. And so,
and can I say one more thing?
Oh, sure, of course.
I appreciate the opportunity to spread the word about, inequalities as it relates to older adults and what we're doing in the community to help impact and help provide resources and services. However, if there are anyone that is interested in the SNAP food stamp program and they know an older adult that can qualify based upon the eligibility that I talked about as far as the income standard, have them give me a call. It's the same number, 419-382-0624, and my extension is 1137. Thank you, guys.
Thank you. So this was a wonderful topic. We really need to tell the stories of people who are impacted, but are often neglected and forgotten. Mm-hmm. And so it's a wonderful way that our agencies can work together, and as we look at the intersectionality of things that are related to race. If you complete the evaluation and you know of other organizations or individuals who are doing great work in addressing the causes of health equity, please make sure that you put them down in the evaluation so that we can contact them and bring another session to you. We're looking for presenters for future Lunch and Learns. And so if you're interested, I'm also going to put another link for an interest form that you can fill out in the chat. So let me just spend a couple of minutes before we close to share some resources with you from the YWCA. I encourage you to join us October the 18th at 6:00 p.m. for our community book discussion. This month, we are reading a book called The Sum of Us, and it is how racism costs us all and how we can prosper together. The book is by Heather McGee, and you can register on our website, and you can obtain the book from the Toledo Public Library in all formats. So, continuing our work in advocacy as it relates to racism as a public crisis on the state and the national levels. And on the local level, we're really excited about the work that we're doing around TREC, which is an acronym for Toledo Racial Equity and Inclusion Council, which is headed by the YWCA president and CEO, Lisa McDuffie, and Bob LeClaire, the former president and CEO of Fifth Third Bank. So anyone who's interested in pushing this agenda of equity in areas, there's different pillars in education, in economics, workforce development, criminal justice and police reform, and housing, please contact us so that we can get you involved in a work group. Also, looking into the future, we are getting ready for another 21-day Racial Equity and Social Justice Challenge in 2022. And also, we are currently planning our 2022 YWCA Stand Against Racism. We are always looking for community partners to help us plan the conference. So if you're interested, please contact us. And last but not least, the work that we do around Dialogue to Change, we're working to bring that back to you in person because of the COVID and the pandemic. We had to pause the program, but in the meantime, while we're working on bringing that back to you, we can provide you with racial justice education via Zoom. And all you have to do is contact us via our website at www.ywcanwo.org, or you can call or email me directly. This has been a wonderful program. Again, Tina, thank you so much for all the information that you shared with us today. Jan Ruma, and on behalf of Healthy Lucas County and the YWCA, thank you so much, everyone, for joining us for yet another Lunch and Learn. Have a wonderful weekend, and we'll see you next time. I'm going to put the links in the chat once again and give you a little time to click on them. And please complete the evaluation so that we can know how we can improve, and also to know topics that you would like to discuss or like for us to discuss at future Lunch and Learns. And once again, if you're interested in presenting, please fill out the interest form. Have a wonderful weekend, everyone.